Sanibonani Dumelang, ka lebitso ke Portia, ke Ndoda Makume, and welcome to the Health and Wellness Talk. This is brought to you by the Directorate of Health and Wellness by Tshwane University of Technology. Now, today we're speaking about one sensitive matter that most of us know about, and some are still a bit skeptical about it. They don't know where to go, and we will be answering each and every question that you might be asking yourself while you're sitting at home. We are talking about voluntary medical male circumcision. I'm not alone today. I have a few people who are, some are knowledgeable about this, some are students who have questions and they'd like to answer or they'd like to have a discussion pertaining that. I'm going to allow them to introduce themselves. You guys good? You are ready for that, right? Okay. Let me start with you. Please introduce yourself. Tell us who you are.
Hey everyone, my name is Rulani Mbatsani. I am a second year student at the Tshwane University of Technology, and I'm also the chairperson of Peer Education.
Nice one. Yes, Sissy.
Good day, everyone. My name is Nicole Mugwena. I'm from Higher Health. I am a campus care worker.
Greetings, ladies and gentlemen. My name is Levi. I'm a second year student at TET and I'm a peer educator and a director.
Okay, greetings everyone. My name is Desire Mavimbela. I'm a student and also a peer educator and also under the Department of Project Planning under the peer educators.
Hi everyone, my name is Nimkabanani Chanduko and I'm a peer educator and a second year student at Tshwane University of Technology, Pretoria Campus.
I love that. So this is what's going to happen. I want each and every one of you guys to be comfortable. We're just going to have a conversation. Let's even forget that the cameras are here, right? Let's just take it trikatung and everyone is having a conversation. So there is one question that I think can be maybe an icebreaker, Nyana. What do you know about voluntary male or medical circumcision? Let's start with you, Abud.
Okay, for me, I can say VMMC, it's an free male circumcision whereby it's done by a practical or professional healthcare worker.
I like that. One lady that can take that. What do you know about it? You can. All right.
I know that the VMMC is, first of all, is voluntary, and also it includes the process of removing the foreskin of the penis in men.
So, since we all are aware of what is VMMC, right? Where did you guys first hear of it? Like, was it at campus? Were you watching TV? Was it back at home? Did they probably tell you that, you know what, you need to go to initiation school or anything of that sort? Where did you first hear of it? I'll ask you this side.
My first time hearing about VMMC, I was still in primary, I remember. They used to come, those people from the healthcare facilities, come and teach us, encourage us to go and circumcise.
Nice one. Sis, you want to take it or should I still give it to the students? I think they can run with it. Anyone, Sissy? Where did you first hear of it?
I first heard it when I was still young, when I went to my grandmother's side. And yeah, my grandmother just took the kids, my brother and my cousins. And I was like, where are they going? They're like, oh, we're going to the hospital. When they came back and then she explained that, oh, this is what happened to your brothers and your cousins. And I'm like, interesting. Okay. Yeah, this is where I heard it.
I think most of us grew up with the conception, or rather, we knew that. Well, I know from my side that in most cases, I didn't even know that one can actually go to a hospital for that. I knew that you have to wait for a certain age as a man, and then they have to take you kokomeng in the mountains. That's how we have always known, or how things have always been done. I think this one will come to you, Sissy. What are the health benefits of VMMC?
Well, I believe that VMMC reduces the risk of getting or acquiring HIV in men, especially in heterosexual relationships. It also reduces the risk of getting STI and it improves the genital hygiene.
Okay, nice one. Do you guys perhaps know other benefits of the VMC? Anyone? Yes.
I know it reduces the chances of penicillin cancer.
Cancer. Oh, that's nice. I didn't know that. You see, love this topics. So do you guys think that VMMC provides complete protection against HIV? Why do you guys think that it doesn't? Anyone? Yes, Puti.
I can say VMMC does not provide full protection of HIV and AIDS. That's why it works best when we combine it with safe sexual practices like using condoms and also PrEP to like that.
Anyone else?
Adding on that one, I can say also if you practice safer sex and also maybe regularly testing your status, knowing your status, take a quick in a safer space that maybe our child be that you were second started, not practicing safer sex.
Nice one. Chairperson, still want to add? They covered. All right.
I think I think people well confuses risk reduction with prevention. So when they say it reduces the risk of getting, they're not saying you are preventing the infection or HIV or any other infection, sexually transmitted infections. So it doesn't. So you need to, hence, Madam Abundela had said that you need to engage in safer sexual practices like regular checking for STI, regularly testing for HIV, and also using a condom, and also considering the fact that there is, it also affects the maternal part as well. So females should be aware that when a male does this, what do they need to do labor on the side? So they also need to consider family planning when we bring the VMMC in this time.
Nice one. I get a lot will Luna back anam. We're not doing that. We're definitely not doing that. But one of the biggest myths or misconception when people believe when it comes to VMC, I know one of that we just said now, it's that people assume or they tend to believe that it's preventative of HIV and AIDS or other infections, but that's not the case. What's the other one that you guys might know of? Yes.
I know that some people believe that if you get circumcised, then your penis will get smaller. Um, and yeah, so many people believe that, but no, that's not how it works. Your penis size is determined by genetics, so that is definitely not true.
Any myths, misconceptions? Majita. Lona Ladula must. I know you guys sit down and you talk about these things. Limauti. You have another word.
I think I also have one. So the misconception around the VMHC is that most males believe that getting circumcised is about, well, for you to get circumcised, you need to be sexually active. So that's what they believe, which is not
True.
Yeah.
Sisi Wena, you said you have another one. Yeah.
Um, Also, most men believe that it'll reduce their sexual performances and that it won't feel as good when they get circumcised. And I can guarantee you that is also not the case.
So here's the thing. I'm gonna come back to you. Here's the thing. Most of the misconceptions and the myths that you guys have mentioned mainly are the negative ones, right? There are those ones that are also positive that most guys would say that, hey, ngindoda mina, when you go to circumcise, others have that thing. You would say there is something that maybe it would enhance your penis or anything of that sort. There's always that positive side of it that says that, or that pushes most guys to say, I need to go and get circumcised because of this and this and this and that. You wanted to say something as well?
I wanted to say, or most of these things, I feel like most of them they come from our great grandfathers. Our great grandfathers, maybe they were scared, or they cut my thing off. These things, all those things. So it comes from back then, and then in the family, the whole family now, they're all scared, or hell, my great grandfather didn't do it, and it's fine, and everything. So I believe most of them it comes from way back. They were scared from the start.
Because I also know that culturally, there are some cultures that still believe that you are not supposed to go and get circumcised. So I think that's also another thing that we are here to talk about, to also highlight those risks if one decides that I don't want to go into that. What is it that you might be risking and all that? Now, moving on, why do some men fear getting circumcised? We did actually mention some few here, but maybe let's just highlight them and add on those.
Wow, I think it's the fear of uncertainty. Remember, they don't even know what uh, VMMC is about. Most of them, they don't know what it's about. They don't know the procedure, they don't know the pain, they don't know the recovery. So the fear comes from, is it that painful? Am I going to bear the pain? Am I going to heal as soon as I'm expecting to heal? And then another issue is that they do not have the accurate information from either a clinical team. So basically, they lack information regarding the whole procedure. And yeah.
Hey, and the best man is men are scared of pain. Yo! Anyone, gents, do you guys know what could also be ESS?
Oh, this one is actually a bit funny. Most of these men, most of them from a young age, they are again when they come back, they can't really properly walk, do play, run, all those things. They make them wear skirts and dresses. So like if you see someone, it's cool, or oh, this one is working this way and all of that. They feel like, no, I don't want that. I really don't want that. And when they go to play, now he's coming out wearing a skirt. They're like, no, I don't want it. I don't want to wear a skirt. So yeah.
Yes, yes. I think it
Yeah.
also be good.
Yeah. What I can add, I'll add to what Miss said, because most of the men, they lack accurate information. They assume that it is painful. So, since they assume that it is painful, they don't know that there are safe medical procedures that are followed, that are done, so that it can help to reduce the pain, so that you feel less pain during the process.
All right. Now let's come to one thing that most people tend to be excited about, right? In reality, that would be sex. Do you guys think that, or does actually circumcision affect one's sexual performance or fertility? Does it enhance it? Does it lower it? Is there any difference afterwards?
According to my own experience, I can say it enhances it. I can put it in a way that before I on second sight, I can say whenever one like in the way I was so I couldn't like feel the way I'm feeling it after this and inside. So yeah, I think it enhances your way it is in sepsis.
Mm, yeah. Wow. It's happening. It's happening. It's been the
We'll come back. The ladies, what do you guys have to say? Do you guys think that does it enhance? Uh, Experience wise, is there any experience? Is there not experience? Is there something that you've learned about? Mm.
Okay, from what I've seen, yeah, I feel like you see when you're getting a knee and then the process, and then you see, or this thing does not look the way that it's supposed to. Girls are gonna run away. Let's just be honest. Most of them, they're gonna run away.
Which one is not normal? Which one is normal? I'm trying to understand that.
The one that is normal is where you can with circumcision. Yeah. Also, adding on that one, I can say it also boosts your confidence. Also, called as men, if I go to the toilet and then I just rip out my zip and then I take out my face and pee and look at the other guy maybe at the first key to see somehow because most of the men they do wish you not you did it 3 circumcision you are up there but that you can circumcision in the historical peers.
I think that those are the positive things that I was saying when it comes to one having to be circumcised that comes with their, so it also boosts one confidence, didn't know that. That's also good. Oh. Kiana, do you have
But
anything
it's
else?
nice of the umpile from a male.
A male's perspective. Yes. Okay. Now that's really good. So a few things that I think, because we also have students here, that as students, there's certain things that you might probably want to add on. There's certain things that you might want to see around your campus or around university as a whole. But most importantly, let's start with this question. What prevents young men or students from accessing VMMC services? What do you guys think that would be something that prevents you? Let's take it as you're a normal student. You're just not someone who is knowledgeable and you're a predicator. You have access to all these things. For a normal student who does not know any of these things, what could be that one thing that prevents them from accessing the services of VMMC?
I have a couple that would prevent me from getting circumcised. Well, the first one would be lack of knowledge, because obviously, like, if I come from a background that didn't get circumcised, obviously I'm not going to want to do it, and I don't know what the benefits of that are. The second one is that I don't know where the clinic is. I don't know, like, the procedure to getting a circumcision at the clinic. I don't know if I'm going to need to pay. On top of that, I'm probably NSFAS funded and I don't have the money to pay for that. So that is probably discouraging to go. Yeah.
So I like that. So most importantly, visibility and also being knowledgeable about VMMC, right? Anyone else?
Sometimes culture plays a role in our religious beliefs. So there are people who come from different backgrounds, culture and religion, wherein they are not allowed to go through this.
Okay. And then someone else? Is there any? Or those are
Some of them, I feel like they're just afraid. Oh, okay. So, like, my friends have to know already. I didn't do it. They're gonna judge me. Maybe I'm a cheater that's sitting there, they're talking about these things. And then when you didn't do it, obviously you're not gonna say anything. So I feel like that's also something that discourages a person to do it, or like to go there. What if they see me? What if they find out? Or now I didn't do it. Now I have to do it. Yeah.
That's true. I think also age plays a big role, hey? Because I think most men go when they're still boys at a young age. They will take you to go to the hospital and do all those things. So now that you are now 18, 19, you're at university and you still haven't circumcised, seems like, at this big age, why am I doing it now? You understand? So I think also that could also play a role in terms of one's confidence, as we mentioned that earlier. So what do you guys think the university or universities in general can do to make VMC services more accessible?
I think we should create more awareness about circumcisions, because as peer educators, our main focus is on, like, promoting safe sex and, like, educating students about substances and, like, blood donation and stuff like that. But we barely focus on circumcision. So I feel like if we focused more on, like, encouraging circumcision among our peers, then yeah, that would raise circumcision, like, yeah, among peers.
All right. Anyone else? How can the university make VMC services accessible? What do you guys think we could do to improve that? Like she said, maybe as peer educators, you guys can talk about it more. Do you guys think that workshops, talks such as this would also help?
Such workshop, because most of the people, as they said earlier, they lack knowledge of this information. So if the university can start improving maybe workshops whereby we have not only peer educators, in other students, they come here, sub discussions. Maybe we can have a way better than doing like only peer educators, we like isolating ourselves, that excluding other students, because most of the students, what they lack, it's resources. About if we can provide those resources, that's when they can participate.
I think I like what you said in terms of also involving other students, because I'd like to believe that I know when I was a peer educator, most students had this assumption of saying that, oh, you guys are the ones of condoms, you guys are the ones of this. It's like this is not for them. It's like this is just for us as peer educators. So it's very important that students also feel included in that as well, to know that this is, as much as I'm a peer educator, I'm just someone who is in the front, but this is for all of us. I like that. So, should a VMMC services be offered on campus? If so, why? Why do you guys think that they should be offered on campus? Do you guys think that it's advisable that at the clinic we have, yes,
Because at the university, I think it's an environment whereby sex is practiced a lot. So, like, being on that one whereby it's an environment where it's exposing students, young students, actually pretty the same percentages whereby it will also help them meet have information in a safe environment and also reduce maybe a rate of the infections or
anyone else?
I think, or I think, yeah, they should be offered on campus because besides everything, we are students. We are busy studying. We are busy moving around. All the whole day, I was attending classes. The whole week, I was busy with something. So, if it's accessible on campus, I feel like it's more fast. It's more easy. You see, there's not a oh, I need to get money to ball to go to the hospital, or maybe the hospital is far. There's no all of that. Like it also, yeah, I think yeah.
I like that. I think another important thing is firstly to deal with the misconception, because we could have those services being offered at the clinic, and then you'd find that no students come because of they still have that thing of being scared that they're gonna see me when I walk, or would see this one, something just happened to them, and all those type of things. I know students who would have an infection and be afraid to go to the clinic to get medication. Because why? One, they're afraid that what if one of my friends see me, they know good I'm here for something, or they'll know that I'm sick or anything of that sort. But all these services are there for the students to utilize them. So I think if we can just try to emancipate our minds a bit and understand that this is how important it is for students to also know why they should do what the circumcision as well. That would really help. Anyone else before I close it? Yeah.
I feel like the same way that we invest a lot in women, teenage pregnancy, period pains, all of those things. I feel like we should also invest the same way in men. Like we're all humans. There's also something. There's no other human in this world where like there's nothing wrong. You didn't do anything. Like there's something. So the same way that we invest, we go to races, talk about teenage pregnancy, prevention, all those things. We should invest more in men too.
I like that. And it's crazy that women are the ones that are more vocal about this. I thought that Majita, you guys will be more vocal on it to say that this is what we want as men, and how it can be accessible is by this way and this way. Because I think you guys are more closer to this, and you guys know what is a bit embarrassing for you, how we can work about it, how should the university go about it as well. Yeah. If you want to say something?
Leo also is based on what the organization that handles your own health, the health, the own environment. Because, for instance, as she say, women are the first people that are prioritized in health services. So, even our promotion, even the curricula is based on HIV, male prevention, instead part based on teenage pregnancy, double is women. So, I think also organization, not only university, but South Africa as large, they're key, there's in this skill or community, they key promote also a head of like, only for about the Yabori or a sharp stuff. So, us also very also you to be the to you see everywhere where I pass, I should see a pamphlet, yeah, you are a man, be strong, to this, yeah, I think it's also promote us.
I like that. As a university, I think everyone who is listening currently would take that to note that it is very important to also make sure that it is as visible as it could possibly be around campus. Make it normal. I know back in the days we used to be very private when it comes to period pains, to periods and all that. But because we see it now often on television, on adverts and all that, it's normal now. And men are now even comfortable to go buy pads as well. You understand? So I think if it can be more visible so that everyone can see it and they get used to it, it will then become normal and everyone would know that there's nothing wrong with one getting circumcised. Right. Now, moving on, after one has gotten their, or they've gotten circumcised, why is it still important for one to use condoms? I think I'll come to you, Sissy. Why is it still to use condoms even after you have been circumcised?
Getting a VMMC does not mean that you have completely prevented for infections, STIs, HIV. So it's just a way of reducing the risk of getting infection. Yeah.
Okay, anyone else?
Okay, what I would say to these things, people like Miss said, people miscommunicate this kind of information that VMMC does not provide full guaranteed protection against HIV and AIDS. That's why we always, there's healthcare facilities, they encourage people that VMMC works well when you combine it with safe practices of sexual, like condoms. That's when guaranteed it. But without condoms, it's not 100% guaranteed.
It's not 100% guaranteed. So condomize all the time. Right, yeah. So why is HIV testing recommended before VMMC? Why is it recommended for one to take HIV tests first before they can get circumcised? Anyone? Don't you guys think that, okay, I'll come to you. Don't you guys think that it's because probably like what we were saying now, that most people have this misconception of believing that when I get circumcised it means that I'm fine, I don't need to have to condomize and all that? Isn't it because of that misconception of saying mangisuka la ngizobabonisa ukuthi mina ngiyindoda? So I probably you don't even know your status at that time. That could also be a thing, right? Yes, yes.
I don't know if this one is true because um the trained health practitioners they do wear gloves and everything. So but touching blood that is
Guys.
uh,
And I get you.
you have to test first. Obviously, if the doctors have to be in a situation where they have to touch the blood or like inside any fluids in someone's body, they have to test these things. Yes, for the safety of everyone.
Okay, I get that. I don't know, Sissy, if you wanted to answer that. You covered. Okay, you can go for it, and then I'll just close on that.
Mhm. I think it's also very important to test for HIV before you get circumcised, because next thing you test after getting circumcised and then you blame everybody. You're like, oh, I got HIV from the clinic. Oh, I got HIV from that person. And but no, you got HIV from way before you got circumcised. So yeah, I think that's why it's important.
She just reminded me of something. So, not under my scope of practice, but I believe that the HIV testing before the VMAC is part of the medical procedure. Just like when you're pregnant, to go through, all the tests, STIs, HIV. So
I love that, because I was actually gonna say that now when you go to a doctor and you say that I'm sick, the first thing they do is that pregnancy test first, and then we'll cover everything else out, right? So it does make sense. So how long should a person abstain from sex after being circumcised, and why should they wait that long? Majida, you guys have experience. How long did you guys have to wait? How long did you have? Yes.
After the circumcision,
After you've been circumcised, how long did you have to wait before?
a full and a healthy recovery takes 2 to 6 weeks. But it will depend because the individual differences. But your medical check is 2 to 6 weeks for a full recovery.
Yeah, I can say approximately 1 to 2 months, because you need to let the wound heal first so that everything, the veins are in a correct order, so that we continue doing.
All right. I don't have experience in that. Sissy, by law, by health, is there any specific one that you should go for? Or it all depends on someone's body?
Ooh, well, apparently they say the health professionals prefer them to heal by from 6 weeks and above. But then they should be
Fully healed. All right. An awesome one. Now, ladies, this is for you guys. How can women encourage men to consider a VMMC without pressurizing them? How do you tell your say, baby, look, ne? Aso hore ke re, you are not satisfying me. Mare ke ne ke re, don't you think that it would be best for us to, you understand? How do you do it without having to pressurize me?
Well, I will have to think about my health as well. So tackling this has to be in a sensitive and a supportive way. So I'll have to sit down with my partner and then just go through the steps with him on what are the risks of not getting a VMC, how will it affect our relationships, and then where can we get health in terms of medical information, and they take it from there.
Nice one. Sis, I think you want to say something? All right.
Um, I'm gonna go back to what Bab Atepo said, that he was like, before he got circumcised, he didn't feel as much pleasure as he did after he got circumcised. Is that correct? So I'm assuming, because there is a myth that also wearing a condom reduces pleasure. So I'm assuming that if my partner wasn't circumcised, the chances of him saying that "Unyaka ka nama" would be like, yeah, yeah, yeah. So that, yeah.
Okay.
Mm-hmm.
Smart. Hey, leba strategic bangena baka. Yeah, I know. Anyone else?
What I want to say is exactly what the chairperson said, and also how baby it would look nice.
As for it would look nice. Elena. So, what role do peers, parents, and partners play in men's decisions about being circumcised, about VMMC? What roles, Hona, as the community, what role do we play in terms of men being circumcised? I know for one is that, honestly, I hardly pay attention to that. If I'm really being honest, it's at the back of my mind. It's not as, like you said, in terms of visibility, it's not as visible as we know when it comes to teenage pregnancy. We know when it comes to and all that. It's very, you understand. So it's one of those things that you know them, but you also like, okay, it's whatever. It's that. Anyone? What role do you guys think that we play? Yeah.
I think that we play a part in changing the way that men feel and think about circumcision. For example, if you come from, like I said earlier, like a community that doesn't believe in circumcision, obviously you're not going to believe in getting circumcised as well. But if a community is breaking the stigma against circumcision and encouraging it, then yeah, you're also going to want to, yeah, get circumcised.
I think I like what you just said now, because I also noticed that the reason why I'm saying it's whatever, or I'm not really paying attention to it, is because I know and I believe that, not that I believe so, but I know that I grew up in an environment whereby, could say at a certain age, a man has to go get circumcised. So when it comes to medically being circumcised, nobody really pays attention to it, because in our culture, you grow up knowing that at a certain age, ga o nka go isa thabeng as a man, and then you come back. I don't know from how you guys grew up. I don't know how you guys do it, but only now in the modern world that we see most mothers being proud to say that I'm taking my 5-year-old, I'm taking my 7-year-old child to go get circumcised. But back in the days, it was not as public as and now we're trying to make it. So I think the role that we could play mostly is a visibility, making it normal. Right? Anyone? Yes.
I think, okay, I come from the villages, a small village in Limpopo, and they normalize these things.
Yeah.
Like if they didn't see you or when you didn't go to the mountains, because they normalize going to the mountains, that means you're not really man enough. If you don't know those songs at the mountains, those things, you're not really man enough. So those men, especially when they sit together, they encourage one another. But you need to do this and you're a real man.
Yeah.
Yeah, no. I think we really need to have engagement in the medical male circumcision more than just being circumcised, right? I don't know anyone if you guys have any last words before we wrap it up. Last words, anyone? Chaperson. Ngiyazi ukuthi ungayivala. Siyazi ukuthi ungayivala.
I just want to add for my last yeah, I just want to add that when you do get a circumcision, if I'm not mistaken, I heard that you do get like a numbing injection in your area, in your genitals. So it's not as painful while you're getting circumcised.
Sissy?
Well, just to add, and the fact that we've been talking about fear of getting the VMMC, sorry, males can actually go to a psychosocial professional who can help them go through the emotions, the fear, and then, yeah.
Nice one. Puti?
I mean, I'll just use it priority. I think they have to make it visible because if they make it visible enough, like in the government kids, reducing maybe I'm a cost for spelling or I'm a medication, right? So if they can maybe invest money like making visible in like local public hospitals or PD site to that create everyone participate, increasing healthcare costs.
Nice one. Puti?
What I would say, male circumcision also benefits the public because an increased VMMC, it also reduces the risk of HIV infection rate in the community.
Sissy?
Okay, my last words. Being circumcised doesn't mean hooray, you're safe from HIV. Okay.
Nice one. As you guys have heard, to those that might be asking themselves, where do I go? If you're around Pretoria, you can go to the Tshwane District Hospital in Pretoria CBD. And these are the ages, or rather, this is the information that you can go with. It starts from the age of 10 years old. And older. We're not saying that 10 and then 18 and then, no. We say from 10 years and older. What is required is a copy of one's birth certificate, proof of residence, affidavit of certificate for a minor, and then a copy of an ID of a parent. This is for someone who is underage, right? But if you are older, obviously, you just have to take your ID and then go there, get circumcised. Operating hours or days, it's Mondays, Tuesdays, and Thursdays. Ward 53, Gate 7 for cars, Skinner Clinic Small Gate for pedestrians, area dam action not applied. So there's the information that will assist those who are around Pretoria and you need information. This talk was brought to you by the Directorate of Health and Wellness. Kalibizeki Posha, Kimrada Makume, and bye-bye.